Awesome. All right. Hi, you epic humans. Thanks for joining me tonight. Firstly, I just want to say, as I wrote in my Mamma Mia article today, that if you are pregnant right now, I am really sorry. I'm sorry that this COVID-19 has totally come and stolen your limelight. It's cancelled your baby showers. It's limited the amount of people you can have with you at birth. No more birth photographers, no more doulas. It's meant that you can't introduce your fresh little newborn babies to your parents and your other children. It's also meant that all your mums groups have been cancelled, the face-to-face stuff, and those long, beautiful cafe lunches and get-togethers that you're meant to have on maternity leave have been cancelled too. So I am really sorry from the bottom of my heart that you're experiencing this. But my favourite quote in labour is that we have a secret in our culture, and it's not that birth is painful, it's that women are strong. And you are always going to have to do the work. Pandemic or no pandemic, women have been birthing for tens of thousands of years, and in famines, in droughts, in wars. So you can do this. The work was always going to come down to you in birthing your baby and raising it. And hopefully tonight's class will give you a few extra skills under your belt to increase that strength of yours a little bit, because your body and your baby know what to do. So I'm not going to do a huge icebreaker where we all say, hi, I'm this many weeks pregnant, because there'd be way too many comments. But if you are doing this with your partner tonight, please turn to them and tell them what the most positive thing or most exciting thing you're looking forward to about bringing your baby into the world, the thing that you can't wait for the most. And if you're watching this on your own, feel free to type it in the comments for me. I want this to be as interactive as it can be. I'm going to allow for questions at the end, but if you've got questions, pop them up and I'll try and get to them after I've posted this video. But I'm going to try and ask questions. I'm going to get you to get up and do some things and get involved. Feel free to just watch it in your bed and think I'll do that later. But I really want to try and make this like an interactive antenatal class so you don't have to miss out too much. All right, so most of you probably said that the thing that you were looking forward to the most was it being over and meeting your baby and having your baby in your arms. Was I right? Hopefully. And really, birth should be the most empowering event of your entire life. You should be able to look back on it and go, I just did that and now I can do this, because motherhood and parenthood lasts a hell of a lot longer than labour and birth does. And it's meant to be this event that instills confidence in your ability as a woman birthing and as a couple, as you transition from either a couple into a family, or a family of 3 or 4 into a family of 4 or 5. And so I'm going to explain a little bit about why you get those empowering, euphoric feelings afterwards. But my biggest passion is that so many women get robbed of having the most empowering event of their entire life. In Australia, we're one of the safest places to give birth, but the risks that you have when you go into labour and birth is actually that we're going to do too much to you and too much intervention. So the World Health Organization says that our caesarean rate should be 10 to 15%, and it sits in Australia around 30 to 35, and dependent on your place of birth can increase. And so hopefully tonight I'm going to give you some skills for your labour and birth, but also the information behind it to make you understand what your body and your baby are doing. So let's get into some anatomy. I've got this lovely chalkboard. It's not a chalkboard, it's not the 80s. It's a whiteboard, and I'm going to keep coming back because I know people are going to come in and out, so I'm going to try and keep going back. So the first thing we're going to do, I'll do my Adriana Alexander's arms, is anatomy and baby position. So I've got my beautiful little baby here. And this is the umbilical cord. So in the umbilical cord, there are 2 arteries and 1 vein. So we like to refer to it as AVA. I'm sorry if I've just ruined that name for you. So the arteries actually take blood, oxygenated blood, from the woman, the uterus, into the baby, and the veins take it out. So after you've had your baby, you can get a lovely placenta tour if you would like one. It takes me back to Year 9 science every time I do it. But it's really cool to see where your baby has lived for the last 9 months. So lots of people will get the option of cutting the cord, and that should not be taken away from you during COVID. So partners, other support people can still clamp and cut the cord. And you can also tie a cord. You don't need to use a clamp. You can buy some beautiful ties that are available on the internet. I'm going to give you all the resources that I have talked about in a list in the event group, so that if I'm talking too quick or you can't write things down, don't worry, I'm going to recap. So the cord attaches to the placenta, and this is baby side. Baby gets a really beautiful shiny side, and then this is the sac. So Bub's in a sac, and there's actually 2 sacs. We call them the amnion and the chorion, and they're really, really strong, and so strong that I can't get my baby through. I did practice this earlier. You think I didn't? So in here, in this sac, is what is called the amniotic fluid, or the waters. And so when the sac breaks, that's your waters breaking. So our baby's in here, it's full of water, and then it goes in, it's inside your uterus. So the placenta sticks to the uterus. I better put my baby in, head down. We're dealing with normal labour and birth. So tonight we're going to talk all about labour. There's 5 classes if you haven't read the info. Tonight's just labour. All right, so I've got my beautiful uterus here, and then this is my cervix. Now I'm going to get a bit weird, and you're going to be like, oh my God, what is this chick on about? But for those of you that like to actually see things, and that helps you to understand things better, there's a really cool website, I think it's cool because I'm a midwife, called mybeautifulcervix.com, and it started out as an art project, and it's turned into this massive website. But it's a really cool way, especially if I know there's some midwives and student midwives and doulas out there watching tonight. It's a really cool way to understand what we're feeling and what we're talking about when we talk about the cervix. But if you haven't had a baby before, your cervix is roughly about 3 to 4 centimeters long, and this is your pelvis. Your uterus typically hangs towards the back, and if you're someone who spends a lot of time on your feet, like nurses and hairdressers, you can have a uterus that does tend to hang more towards your back. So the cervix is long, it's thick, and it hangs towards your back. In labour, it has to move forward and thin out and open. So we're going to talk about that next. But I just wanted to give you a bit of a picture of what's happening inside of you. So this is a pelvis, the spine is at the back. This is your pubic bone. Most of you probably have experienced pubic bone dysfunction, that pain. It's quite uncomfortable. It was very debilitating for me. This is the coccyx at the back, and so this is where baby passes through, but we're going to do that next week. All right, so that's a quick rundown on anatomy. We're going to talk about baby's positions now. So I'm going to take my baby out of the uterus just quickly. Hopefully you can see this. I can't see all your comments. But hopefully you can see what I'm doing. I'll wiggle forward a little bit. Okay, so majority of babies present in labour in this position. Okay, this is called the anterior. Anterior just means front, and so we're talking about the baby's back in relation to the birthing person. So the back is at the woman's front, anterior. And this works really well because the head perfectly fits in the pelvis. And so for labour to occur, the head has to move down onto the pelvic floor and put pressure on the cervix, which is why having a strong pelvic floor is really important. Wink, wink, I have a program about that. Anyway, so the back is at the front. Interesting enough, babies, the left side is a tad bigger, and so really babies kind of enter into labour like this, and then they turn around. So the left side, when the baby's back's on the left side, is a really good position for Bub to be in. So if you want to feel where your baby is, it's actually quite easy. It's easier for partners to feel this. So I'm going to give you a little rundown on how to do that. When you're feeling your tummy, if you imagine what you're actually trying to feel, so a little tiny newborn's bum is like a teeny tiny triangle. So grab your bum, obviously it's a little bit bigger, but you can feel that it kind of fits in like a little triangle, and that's because what you're feeling are these sit bones, okay, here. And so you can imagine what a little newborn's booty feels like. And then the back's around the front, you're going to feel a smooth edge. So this is what we're doing as midwives when we try to listen to baby's heartbeat. So if you imagine your back, it's nice and flat and straight. So if you can feel this hard side all the way down one of your sides, that's your baby's back. And if you kind of do this around your tummy, you're actually giving your baby a little cuddle when you're holding your baby when you do it. And then the head is round and what we call ballotable. So when you dig down, and don't do this if you need to go to the toilet, and be gentle with each other if you're practicing with your partner, but you'll feel this bit of the baby's head. And so, yeah, that's just a quick rundown on how to feel baby. But what we're trying to feel when you're in labour is the position of baby, and it gives us a really good idea of what baby's doing and how your labour's going. So this position is posterior. So you can see the baby's back is along the mum's back. So anywhere in this kind of, in these kind of movements is posterior. So we're going to do a little exercise here. I want you to make a cervix, okay? So do this with your fingers. And I want you to place it on the back of your head. My husband's watching and it's really off-putting. He's like my biggest fan, but he's standing at the doorway. Love you, babe. He's gonna come and feature in this really soon. But it's putting me off. So make a cervix and put it on the back of your head. So where you're trying to put it is this round bit here. And it should fit really well. So you're putting it that way onto the head. Now what I want you to do is bring it up here on top of your head where it's flat. So this bit. And what does it feel like? Does it fit as well? Is there some space on the sides compared to when it was back here on that round bit? Yeah, there should be. If there isn't, you've done it wrong. So what you're feeling when you've got your hand back here is what we call the occiput. And this is what presents on the cervix when your baby is in this position. So your baby's head perfectly matches the cervix, and so it puts this even pressure on. And so when you're in labor, you get typically really rhythmic contractions. They come, they go, last for a minute, off for a minute, back on for a minute, that kind of thing, 60, 90 seconds. Posterior labors typically present with a lot of back pain, and that's because your baby's spine is on your spine, and your uterus is working really hard to not only dilate the cervix, but to rotate baby around because it knows that it fits better in this position. And so women who have posterior labours, and it's typically around 10 to 15%, but we are seeing that increasing, and it's got a lot to do with how we drive, sit on the couch, on our phones. We're constantly leaning back, so we're constantly moving baby into this position rather than being on all fours scrubbing the floors, which I'm totally grateful we don't have to do, but you know, we need to be moving and exercising so our babies are at the front. So there's an incredible resource called Spinning Babies, and if your baby's in a posterior position or breech, which is bum down, or any other position, they've got great techniques and exercises that you can do. I'm not affiliated with anything that I'm mentioning. I just really love these products that I'm going to mention to you guys tonight. Okay, so if it's in posterior, you've got that cervix, the head presenting on the cervix up here, okay? So baby is unable to bring its head down nice and tight because of this front pubic bone, okay? So it can't bring its chin to its chest to make its head smaller, to make the diameters of its head smaller, to pass through the birth canal so easy. Babies in this position can totally be born vaginally, okay? So don't be freaked out by it. It's just that the labors are often longer, more painful, and the contractions, you know, you might get one that'll last 1 minute, and then 5 minutes later you'll get one that's 30 seconds, and then 3 minutes you'll get one that's 60, and then 7 minutes later, you know, it's another 60 seconds. And so there's no coordination. It's completely all over the place. And that cervix doesn't dilate so well, and it takes longer to do. And the uterus is working really hard to bring the baby around. So I'm just going to pop the camera back and show you a really great tip to do. But basically anything forward leaning and exercise is really good too, but you can straddle a chair. So I'm just going to take you back, and then I'll bring you back. That's all right, thanks. Hubby's trying to come in to help. He can help after this. So sitting, anytime you're watching TV or eating dinner, you can actually just sit like this and straddle a chair. Even if you're working, doing that is cool. And we're going to talk about some tips that, can you bring the camera back? Is that all right? He's my roadie. We're going to talk about some tips for pain management if your baby is in a posterior position. Okay, so that's anatomy and baby positions done. Tick. Let's get on to early labour. All right, so let's go back to our uterus. Hopefully you're all still here and I'm not just doing this on my own. That would be highly embarrassing. I've done sillier things in my time though. Right, so we've got our baby in the uterus. It's a lot harder to get it is to get out. Okay. So this is our cervix. So early labour is typically what we talk about in terms of cervical dilatation, 0 to 4 centimetres. So what has to happen is this cervix has to move forward. It has to get really soft. So if this is your first baby, the cervix is quite hard. If you've had a baby before, it doesn't go back to being as long and hard as it was in your first pregnancy. So if it's your first pregnancy, think about it like a closed locked door. And if it's your second or multiple, think about it as a door that's kind of ajar a little bit. All right, so it's long. And what it has to do is it has to start to thin out. And I'm going to show you with a balloon as well. But it basically has to thin out until it becomes one with the uterus. So if you see that, it's like 4 centimeters, and then it starts to disappear and get really, really thin, and then it starts to open. And it obviously has to open to 10 centimeters, which is about that big, for baby to come out. But the early stages of labor is this becoming thin, soft, and starting to disappear, so rolling up until it comes up here and is one with the uterus. So this is a time if you've gone into labour on your own. So that's what we're talking about tonight. We're not talking about inductions. That'll be in another week. This is all normal, natural labour that we're talking about. So if you've done this and you're at home, this is not a time to get excited. Don't grab your birthing balls out and start bouncing up and down. Don't start timing contractions. Your body and your baby know what to do. Just let it do its thing. So this is the time to rest if you can. This is a time to eat well, hydrate. You might want to hop in the shower if that pain is becoming a bit more intense. And so this is where that pain starts to feel like strong period pain. And I'm going to talk about pain in a second, but I do use the word pain because the majority of birthing people find labour painful. So you can use the shower. It's not a time to hop in the bath just yet, and that's because we don't want to relax you too much to knock that oxytocin off and slow down your labour. But it might start off and you might get one contraction and then you might not get another one for another 20 minutes or half an hour. So just resting, you might want to watch a movie, you might want to go to try and sleep and get 20 minutes sleep in between contractions. If it's during the night, try and go with your body and sleep with your natural sleeping times. Sometimes labour can start and then it might start during the night and then it might stop during the daytime and then it might start again that night. Sometimes that can happen, and sometimes women have what we call spurious labour. And hopefully tonight, the information and skills I give you kind of make you feel a bit more confident and trusting in your body, and hopefully that makes your labour a bit more effective. It should. So we get this thinning out of the cervix. So shower, eat, drink, sleep, heat packs. If you haven't got a heat pack and you don't want to go out, a really cool tip to make one on your own is to get a towel, wet it, just so it's damp, not so it's dripping wet, and stick it in the microwave and heat it up. It will be really hot when you get it out, so be really careful. Use tongs, stick it in a plastic bag after it's been heated, and then chuck it in a pillowcase, and you've got, voila, your own heat pack without having to go to the shops in COVID. All right, so that is early labour. Active labour is from around 4 to 6 centimetres, so the evidence on that is changing. And this is where your contractions have really ramped up, and they're working from the top down now, and really you feel them all over. And so with early labour, it's quite a low pain, like I said, like period pain. It's quite in that where your cervix basically is, that lower belly, and it may even be in your back. So if you experience back pain during periods, you'll get that. So that often will start at the back and come around. Active labour, the contractions are a lot more stronger. And so the cervix is already opened about 4 centimetres when we've got into active labour. And then it goes all the way to 10 centimetres. And that's the end of your labour. When you are into the first stage of labour. We go into the second stage of labour, which is pushing, and we're going to talk about that next week. So I want to talk about pain first of all. So I like to talk about pain in labour because I think it sets you up really well to succeed if you understand what's going on. So what's the difference between labour pain and other pain we experience in our lives? Does anyone know? Shoot me a little comment. I'm seeing lots of messages come up, but I don't know if anyone's seen it. If you want to write a comment, write a comment. If you watched my video the other day with my streamers and my pom-poms, you'd know exactly what I'm talking about. But basically, we've got pathological pain and physiological pain. Pathological pain is the type of pain that you get when you cut yourself, stub your toe. I did that today. God, it hurts. Pain that you experience in pregnancy, like backache, pubic symphysis pain, pain from, I was going to say something else, but I'm not going to say that now. Anything where you get hurt. So anything that is a response to injury. So pathological pain is pain that we're not meant to experience, like getting a tooth pulled. It is your body's way of responding to injury. It's your body's way of fixing something. Labour is not an injury, it's not an illness, and it doesn't need to be fixed. It is a natural event that your body is programmed to do. Your uterus is a muscle, okay? It's a smooth muscle, not a skeletal muscle, but it is a muscle. And that's why I use the word contraction, because it's a really powerful word. It's exactly what the uterus is doing. It's contracting. If you can understand that, you'll trust your body a hell of a lot more. The pain you feel in labor is not stronger than you, okay? It is a part of you. It is one muscle doing all that work. Please, please believe in yourself here, okay? It is a part of you, therefore you are stronger than it, and you will always be stronger than it. It will challenge your mind, and we'll talk about that in a little while in the next bit. It will challenge your mind, but it is not stronger than you. So, when we're going to do this trick in a little while, but basically the whole, and I do this in my pregnancy program, is I train you to mentally prepare for your labor. So pathological pain is that bad pain when you cut yourself, stub your toe, get a tooth pulled. Physiological pain is the pain that you feel when your body's working hard. So if you've ever done a wall squat, and I'm going to make you do one tonight. Yeah, I am. Yeah, I'm going to make you do one too. Don't tell you. Physiological pain is when you do a wall squat, when you do anything in your core and you get that core burning. That burning muscle feeling is your muscles contracting. So when you're on a wall squat and your thighs burn, when you're doing squats and clams and your bum's sore, The feeling after exercise, that DOMS, that's a physiological pain. That's your body that has worked hard. It's not trying to fix something like bleeding or things like that when you cut yourself. So believe in yourself, train hard, mentally and physically prepare yourself for labor. You wouldn't turn up to a marathon, and half of you are like, I wouldn't turn up to a marathon anyway, but you wouldn't turn up to a marathon having not mentally and physically prepared. You need to go into your labor and birth having prepared for it. Now, what's going to happen to you is you're going to get this crisis of confidence. So we're going to talk about pain management after this, but I really want to touch on this. Crisis of confidence is a term that Rhea Dempsey coined. Her book is called Birth with Confidence. It's the only book you need to read when you're pregnant, and your partners and birth support people, whoever's supporting you, needs to read it too. My husband was like, when I was in labor, where are we at in Rhea's book? And I was like, shut up, stop, I'm not thinking, I need to just labor. But the crisis of confidence. So right now, I want you to think about something that you've done in your life that's been hard. Finishing school, starting a new job, doing a university degree, maybe something physical like running a marathon. And if you're not pregnant and you're watching this, I want you to think of it too, because you as a birth support person really need to understand this, because this is where you come in. So a crisis of confidence is where you want to quit. And I know when I did this, I've done a couple of uni degrees now, and every time I've done it, I've wanted to quit. Even with my programs that I've launched, it becomes too hard. I don't want to do this anymore. And so when women have a crisis of confidence in labor, they typically say things like, I don't want to do it, pull it out, cut it out, give me a cesarean, I'm not doing this, I'm going home. All these different things. Now, I had a home birth in Melbourne. I was a home birth midwife at Sunshine Hospital for a while, and I had a home birth with private midwives. And I can clearly remember my crisis of confidence. I was in the shower alone, butt naked, and I looked up at our long, thin window, and I was like, I'm going to climb out that window. I'm going to hail a taxi back naked, and I can totally do that because I'm a labouring woman and they'll pull over and get me. And I'm going to catch a taxi to the hospital and get an epidural. Now, I never voiced that. No one, my husband was the only one there with me at that stage, and he wouldn't have known that I was thinking that. But that was labour pain challenging my mind. That was, I can't do this anymore. I am not strong enough. And when women say that to me in labour, my answer is always, you are doing it. You are doing it, and you are doing it beautifully, because you are. And so partners, birth support people, this is where you come in. You are the most important person in that birthing space. Now, the person birthing is pretty important, but you're the coach. And a lot of partners feel really helpless in this situation. But what you say and do has the most effect on your partner's labour and birth. And believing in them and supporting them and trusting that their body knows what to do is going to make it a hell of a lot more positive. So I'm going to give you skills to make it better, but instilling a calm environment and just instilling that confidence in the person birthing is what will get her there. So a crisis of confidence can typically hit at the start of active labour. So remember we talked about early labour being the cervix thinning, getting shorter, and then active labour starting at around 4 centimetres to full dilatation. And so as you transition from that early labour into active labour, some people will experience that crisis of confidence then. Pretty much all people experience it at around 8 centimetres, which is transition. And this is when you'll want the drugs. This is when you'll be over it. And it's a really cruel thing, because it's like the universe's way of saying, are you ready for this? Dun, 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 dun. Sorry, I always break into song. But that's exactly what it is. Are you ready for this? And some women, it'll last 30 seconds, and others, it'll last an hour. And so this is where you need your skills of magic tricks to get you through that. Because once you're through that, baby, you are pushing. And that baby is going to be in your arms and in your chest, and you're going to snuggle it, and it's going to smell delicious, and you'll get to kiss it for the rest of its life. All right, so I'm just checking because I've got so many things that we've been going through. So we've done this one, we've done early labour, we've done active labour, we've done path versus phys, Done our crisis of confidence. Let's get into the juicy stuff. Hopefully you're all still with me. Oh, yeah, you are. Good. I mean, am I engaging enough? I hope I am. All right, so pain management. So we're going to have some fun here. We're going to get into the non-pharmacological stuff first. My favorite technique, and if you follow me on Instagram, you'll know this, and if you know me already, you'll know this, but it's horse's breath. Yeah, you're going to do it too, okay? So the whole idea is if these lips are soft, these lips are soft. And you can't see my lips, can you? Do you need to? I mean, I've got pants on, but if these lips are soft, these lips are soft, all right? And we want everything to be soft. So, start of the gastrointestinal tract, your anus is the end. Your jaw is linked with your hips. So if you've got hip pain, get your jaw released. Getting your jaw released in pregnancy is really, really important. I've just said that during COVID, and that's really annoying because you have to telehealth everything. I'm sorry. If there's people out there that can help you, you can actually get a tennis ball or just fingers. Partners can do it too, and just relax it there. But horse's breath is going to help you. There you go. I made a recovery. Whew, full recovery. Horse's breath will help you to relax your jaw. Your vocal cords are connected to your pelvic floor, and your trachea is connected to your vagina. If you look at pictures of all of this and the pelvis, so this is our pelvic floor. This is what I've been talking about. There's this chick that does this epic program called Core and Floor Restore. Her name's B. She's a midwife as well. She's epic. Do her programs. You'll learn all about the pelvic floor. But this is your pelvis in a bigger version. And so that's the pelvic floor, and it holds everything up. And so if things in here are tight, you imagine your poor baby's trying to get out. It's trying to get down and out through all this. If you're like this, ow, 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 it hurts, and everything's tight, it's going to make it a lot harder for baby, and therefore your labor is going to be a lot less efficient. So we want to relax everything. So horse's breath, give it a go. You can't do it if you're tight and locked up. Let's go. Let's all practice together. Ready? Yeah, you might have spat on your partner. And partners, I want you to do this too, or other support people. Okay, he's doing it out in there. Do those horse's lips, babe. Make your lips soft. His scrotum is totally relaxed right now. All right, so horse's breath, my number one technique. It's the amount of message, it's how much I love it. I get so excited about it. It's the only thing I really used in my labor. I kept everything else, my little magical bag, to the end, thinking that my labor and birth was going to go on forever. And then I birthed my baby, and I didn't get to use anything that I'm about to go through right now. So that's it. That's what you need. And it is a really great replacement to gas. It works so much better than gas, but we'll talk about gas later. So horse's breath. Definitely my favorite. We're going to practice it again later. So if you didn't do it then, you haven't missed out. All right. Moaning and groaning. Women that are in good labor sound like they're having good sex. And we're going to talk about that, why that is. I said good sex. I'm distracted now. When we get into our hormones. But I've only really cared for, in 13 years I've been a midwife, a couple of women that scream. And screaming comes from fear. Screaming comes from adrenaline. And adrenaline does not do well for us in labor. It's not the hormone that we want to be at peak level. We want oxytocin. We're going to talk about that soon. And so when you moan or groan or hum or sing, just even that again relaxes everything. So there's fascia. If you've ever cooked with meat or seen meat, fascia is the white film that is over meat. It surrounds every muscle in our body. So the pelvic floor is not just made out of muscle, it's made up of muscle and fascia. And so lots of the things that we're going to be doing now are to teach you how to open those muscles and release the fascia. Because if that's tight, it's really hard for the baby to come through. So if you can imagine, if you go into your labor and birth going, it's going to hurt, this is going to be the worst pain ever, I'm not going to be able to do this, then that is already setting you up to not do so well. If you go into your labor and birth going, yeah, it's probably going to hurt, because for the majority of people it does, but I've got this, I'm stronger than it, and I'm going to use what skills I have. I believe in myself, and afterwards I'm going to be so proud of myself, because you'll never ever be more proud of yourself. I've done some pretty amazing things in my life, but birth was by far, it trumped everything else, and not like Donald Trump, like the good trumping. So horse's breath enables everything to relax. But if you go into labor and every time you get a contraction, you're doing this and you're hunching up and you're lifting your shoulders and squeezing everything, that's not going to open up that pelvis. That's not going to get baby down. So horse's breath is our first step to relax and open. Moaning, groaning, going with your body. Acupressure. So acupressure is pressing on the points that we use in acupuncture. There is a really great free resource. It's a free PDF that you can download with all the acupressure techniques, and you can start practicing most of them from 37 weeks. So I'm going to pop a link about that in the events page. I know I'm doing this a lot. I don't know why. I have nervous hands. TENS machine. So I had one of these in labor and I put it on and I was like, oh my God, that is so good. I don't want to use that yet, just in case I'm not as far as I want to be. I'll take it off and I'll use it later. And then I never got to use it. So you can hire these from TENS Australia, and they'll post them out to you and then you post them back. These are epic. You can't use them in labor. So they're really good to use at home before you go into the hospital, if you're having a hospital birth. And I didn't say before, but early labor needs to be at home, especially in this environment. And if you want information on home birth, hit me up later. But it is safe. Home birth is completely safe. It's actually been proven to be more safe for women with the same outcomes for babies. So it's more safe for women because there are less instrumentals, less episiotomies, which is where they cut you, and less forceps. So if you're interested, I'm not going to harp on about it here, but let me know. So early labor, definitely be at home. Be at home for as long as you can. The time to leave for hospital is when you hit that transition, that I can't do this anymore phase. You need to be where you are where you feel the safest because of oxytocin. We'll talk about that. I know I've said it later. But really, the longer you can stay home, the higher chance you have of keeping everything normal. And unless there is something wrong, and if there's something wrong, yeah, you need to go into the hospital. So TENS machine, there's these sticky pads and they stick on your back, and basically they give you little pulses and electrodes of pain. The best way I can explain this is like if you ever had a big brother. I had a big brother. And you were like, oh, this hurts, and they like punched you. You're like, oh, my toe hurts, and they punched you in the arm and gave you different pain and was like, does your toe still hurt? Or something like my partner's mum or siblings, I don't know, he's listening so he'll correct me, when they had mozzie bites, would put a cross into it, like with their nails, to take the pain away. That's what this does. It's got to do with the gate theory on how our brain receives pain. But basically it's giving you these little electrodes and it's giving you a focal point, something to focus on. And they're awesome. So get one if you if you can afford it. They're about $100, I think, to rent, maybe a bit more. But you pop them on, you control it, how strong you want it. If you want it less strong or more strong, get the labor ones. Don't get like a massive machine because people use them for pain in other events in their life. Don't do that. Get one that is specifically for labor and birth. All right, so shower and water. That's where I spent a lot of time in my labor, and so many women I care for do. So if you have a high-risk pregnancy and you need monitoring, you can still be in the water, and you can still be in the water given COVID. There is RANSCOG, which is the obstetricians, the Australian College of Midwives have both said you can totally use all methods of pain management exactly the same, whether you've got COVID or not. So please, if your care provider is saying you can't, you totally can. Get some evidence behind you for that. So the shower is a great way, a great pain management because you're upright and you're moving around. The bath we typically like to use when women are in active labour, so around that 4 to 6 centimetres and onwards. And I keep talking about centimeters. You don't have to have a vaginal examination before you get into the bath. If you're in the bath and things start to slow down, we just get you back out again, get you labouring, get you more active, and then get you back in. So you can be in the bath if you have a high risk pregnancy. You just might not be able to birth in the bath. So there's two totally different things: labouring in the bath, birthing in the bath. You may not want a water birth, but you may love being in the water in labour. And the majority of women don't ever want to get out of the bath because it's that weightlessness, it's that calm, it's that warmth. It allows you to be mobile, and it allows you to rest in between contractions really beautifully. So the shower obviously is great. You're upright. Often in hospitals, if you birth in there, there's poles that are great to hold on to. And you've got that nice warm water coupled with massage on your back. In your birth bag, make sure you've got a tennis ball is a really great thing to massage with, and massage oil, because if you're getting dry massage, your back will be really, or wherever you've been massaged, will be really, really sore from the friction. All right. The other things that are really good to pack into your labour bag are hair ties. Don't forget those, and lip gloss, because your lips get really dry. Lollies and snacks, and drinks like Powerades, things like that, just energy stuff. Because remember, if you were running a marathon, I've run marathons, I had the hydrogel gels, and there's lollies and bananas and fruit along the way, and that's only like, running a marathon, it's 42 kilometers and 4 hours or whatever. Labor can be a lot longer than that. So you want to have stuff, you might not feel like it, you're not going to feel like a roast dinner, but you want to eat and drink. So pack those in. And if you're planning to get in the shower or bath, a change of clothes for your partner or birthing support person is a hot tip too. All right. Sterile water injections is my next thing. So this is an amazing thing to have if you have a posterior positioned baby. So for those who weren't here at the start, my baby was hiding in my uterus. Come out, wherever you are. Posterior was the back on the mum's back. So often what happens in this labour is your back really hurts, and so you're getting really tense. You've got back pain all the time. It doesn't really ease up, and it's really hard to focus on that labour pain. So what you want to do here is have sterile water injections. And this, again, it goes back to the same thing with that TENS machine. We give you pain. I've had them twice when I wasn't in labour. So when you're in labour, you've got endorphins, but it hurts. It feels like your back has been lit on fire for 30 seconds, but then your back pain goes away and all of a sudden you can relax and the muscles around your belly relax, which enable your baby to turn. A lot of women, when they've got a posterior labour, get an epidural. Now, if you get an epidural, you're typically on your back. That baby ain't shifting. That is going to be a lot harder to get out. It's a lot harder to push when you've got an epidural, and this is often when you end up with a vacuum or forceps. If you can have sterile water injections and get that baby to turn, that labour is going to become so much more efficient. So what are they? We basically use the thinnest little needle that we have, the same that we would use for like insulin, and it goes just under the skin but on the back. So 2 midwives do it. You get 2 injections and 2 injections. Oh, here's a pelvis I prepared earlier. So we do them around here and here, and so we go in, and it's water. It's sterile water, and it goes under your skin and it makes a little bleb. Literally feels like your back's on fire for 30 seconds, then back pain's gone. They can work in other areas. I've definitely administered them into like hips if some women just labour and they feel it all in their hips. So ask your care providers if they do them. If they don't, change care providers, because you totally need someone that does sterile water injections. They're epic. All right, I'm going to bring him in. What do you reckon? Should we bring him in? I reckon we should bring him in. Anyone commenting? Should we bring him in? Why can't TENS be used later in labour? TENS can totally be used later in labour. They can't be used in water. Did I say later? Sometimes I say things that don't make sense. You can't use a TENS machine in water because it'll explode. It doesn't work in water. it's just the electrodes, you can't use it. So you can only use this when you're out of the water. So it's a great thing to be used in early labor if you're then in active labor going to get into water. But you can use it the whole time. You can be giving birth with this on, so you can use it the whole time. Yes, you can rewatch these videos. I'm going to post it. Okay, I'm going to get distracted if I look at the comments. So in comes Mickey Moo. This is my hubby, Mick. He's epic. He's going to move the camera away and we're going to get into showing you some things. Woohoo!
Do you want to move the table as well?
Yeah, we'll move that. Put all my notes just to make sure I don't forget anything. This is what we look like in full version. Okay, so we did... Oh, no, I haven't done that. Okay. So, let's go through first some hip manipulation. So, being upright works beautifully in labour because you've got gravity, alright? I'm going to talk about the fact that you don't have to... We talk a lot about active birth. Sorry, I'm going to make you stand there now. I do this all the time, I get sidetracked. So, no, you can come back. We talk a lot about active birth. Be active, active birth, active birth. What we want more than anything is for you to be able to listen to your body. And that is a really hard thing to do in today's society. And we're the only animals that ignore our instincts, okay? We're the only animals that do that. And we often do it because we care about what people think. So all of a sudden you get pregnant and you start labouring and we're like, listen to your body, listen to your body. What does that even mean? And it's something that if you can start practicing now when you're pregnant, it will help you a lot when you're in labour. I spent a lot of my labour laying on my right side because my baby was on my left, so I wanted it to turn this way. If my baby was on my right, I would have laid on this side to help it move that way. But I spent a lot of time laying on my right and just going in and out of this state of consciousness because I had so much endorphins running through my system, so many endorphins running through my system to help me labour. And that's what we want. So don't be afraid of resting. If that's what you feel like you need to do, rest. Often as midwives will say, if you just get up, that labour will come a lot quicker. And it might. It often does because you've got gravity. Some women are scared to get upright because it hurts more. We want more pain because more pain means more gain, means that baby is in your arms quicker. But if resting is what you need to do, then do so. It's hard in a hospital that is busy to rest because we want you in and out. I used to work in a busy hospital in Melbourne. We had 10 beds and 18 births a day. We got to get you in and out. And that's why when I say stay home as long as you can if everything is normal. All right, let's bring him back in. Introducing for the second time. You were meant to be pregnant.
I'm meant to be pregnant now. Okay.
Oh, dude.
I can do that.
We don't have time. Quick. People have got things to do. He's like the biggest YouTube watcher, so he's all about efficiency. Oh, it is low. All right. So he was at my birth. He was actually, funny story. As a midwife, I did a vaginal examination, got it completely wrong. So the midwives didn't come until my baby's head was coming out. But you were there. What was it like?
Fun.
For all those
It's good for me. I enjoy it.
Now, he's watched a lot of David Attenborough DVDs, and you reckon it trumped any David Attenborough documentary you'd ever watched. That's what he said to me afterwards. He was like, babe, that was better than any David Attenborough I'd ever watched. So partners out there, don't be scared. It can be epic. Let's bring that chair in again. All right, so birth balls. Most hospitals have birth balls. You're going to come around here. So I want you guys practicing this at home. If you don't have a birth ball, I want you just to lean on you and your big belly, just put it in the way. I want you to lean over the ball.
Sure.
So in hospital beds are for bags. Stick your bags on the bed if you don't want to rest. If you want to rest, you can have a rest. But it doesn't make sense that we birth up high. If you want to rest, getting on the ground with some bean bags and making a nice little comfortable ground space is a lot better for getting those hormones running. But this is my second favourite technique, so I don't know what you're doing here, but stand up a bit. Stand up and lean over. Yeah. All right, so if you're practicing this at home, this feels awesome in pregnancy. You can do it at any time and practice it every day. Get your partners to practice it. So I'm finding the hip bones. So he doesn't have a clitoris. He doesn't have this shaped pelvis either. But Sorry about that. But this is what we're feeling. So we're popping our hands on the hips. And what we're doing is manipulating the pelvis a little bit. We're trying to open things up and release them. So if your birth support person is doing this now, you have to press really hard. So I'm going to push in and down. And we're doing this during a contraction when we're in labor. So position yourself well and push. So it's actually really hard. By the end of the contraction, my arms are going to be burning. So I do this to women and then their partners have a go and their partners don't do it hard enough. You have to actually really press down. So be guided by the person who's pregnant, by what they feel. So if they say harder, go harder. If not, release, don't do it so hard. So that's our first one. All right. That's one of my favorite techniques. You can do that during contractions, have a rest, they have another contraction, go back down, squeeze, hold it for the whole contraction, rest. And this is a really nice position to be in during in between contractions. So what you would do is you wouldn't have the ball down so low. You put the ball on the bed and put the bed up really high. So you actually, can I just lift this up?
Sure.
So you're kind of like that, a lot more comfortable, and having the pillow there to rest. Ultimately, we want you to be able to get like little micro sleeps or rest in between contractions. That's where we want you to be. And then you get a contraction, you work through it, you rest again, you get through it. All right, so that's the rebozo. We can do rebozo. So hop down on the ground for me. Mm-hmm. We'll do shake the apples first. So yeah, take that away. Just like normal. Do this, don't do this, do this.
Just me?
Yeah.
Alright.
Alright, so this is called shaking the apples and rubbing the branches. So what we're doing here, and we do this in between contractions, and we do this for people who are really squeezing everything really tight, like sucking that butt in and really holding a lot of tension, because we want these bad girls to be nice and soft and relaxed. So again, that fascia, that muscle, we want it to be relaxed. So again, practice this at home. Go on, get up, please, get up. Yeah, do it. Good. All right, so this is how it goes. We're just shaking the apples. We don't want to shake them off the tree. But how does that feel?
So much better.
Does it?
All the pain.
But it's not about relieving the pain, it's about releasing the muscles. Does your bum feel a lot more relaxed?
Well, yeah, probably the most relaxed it's been all day. For sure, yes.
So it's just shaking it. So I'll do this and then rubbing the branches. So he's really tight. He's really nervous right now. I can feel it. And so it's all right. Just breathe through. Can you do some of that horse's breath? You were doing so well before. Well-trained midwife's partner right here. That's it. Blow it out, babe. Blow it out. So this is what we're doing. We're doing the horse's breath, shaking the apples. You guys are like, what video have we tuned into? If they've just tuned in now, they're like, what is this weird thing?
Close this down.
All right, so that's that. You're going to get on all fours now.
Yep.
I'm going to show you some rebozo techniques just quickly. So we can do this at home with a towel or a sheet. You don't need a rebozo. You can do it in the hospital with just a hospital sheet or towel. So you can shake the apples using the rebozo. So it works really well with a rebozo if you make little folds on the side. It's much nicer for the woman. And so then you're just going to grab them on the side. So if you've gone and got a towel, pop it over the back and the bum a little bit. It's so hard because you wear your pants down low. I can't tell. Women don't do that. And then we grab and we just shake. Okay, so I'm standing over and shaking those apples this way. Does that feel good?
Yeah, the baby's just going to fall out. It feels amazing.
Does it feel good though normally?
Well, yeah.
Just say yes, they're watching. They want to believe. Believe, it feels awesome. I did this with a pregnant woman. I obviously couldn't do that tonight because of COVID, but she loved it.
She did.
Okay, stay there. No, we're not done yet. This nightmare's not over. So the next one we're going to do is some sifting, and this is a beautiful thing to do in early labour to help you relax and get those abdominal muscles and the fascia there relaxing. So again, you're going to fold it under, and then you're going to bring it around that belly, and this is a beautiful thing to do even during pregnancy. So take your time, be loving and tender, something I don't do to you often, ever, he says. And so you really, as a partner, want to support yourself here. But you're going to grab the rebozo on either side. And what we do is we lift here. So we're lifting, don't arch your back, just keep it nice and still. So your hands are going to be out from your shoulders a little bit. And your knees are going to be further behind your hips. A bit more towards me. Yeah, so you're not in direct or fours. You're kind of a bit arched out. And so what you do is you're taking the weight off of that uterus and baby off the woman, and it is heaven. So you're lifting up here, and then we're just gently shifting. Now we're sifting. We're sifting flour, we're not making milkshake. So you're not doing this, because that would really hurt and not feel good. So we're lifting up, sorry if I hurt you then, babe.
Yeah.
And we're gently just sifting. Little, and you can get a little bit faster. And you might do it for about 2 to 5 minutes, depending on how long your partner feels comfortable. And then as you stop doing it, you slow down. So I'm going to pop some links up on how to rebozo later in the link to help you out. All right, let's bring that thing back. I think, oh no, elephant walk. Oh, okay. So you can be my partner now. I'll be the pregnant woman.
Okay.
A really nice thing to do here is kind of just hang here. And you can be doing your... And then this is the elephant walk. So many women dance their babies out, and this is about listening to your body and moving the way it wants you to move. So we can do that elephant walking. Spiraling is a really beautiful thing, and again, you can do it with the ball. If you're not a touchy-feely person, I'm not really a touchy-feely person, I just let him do this for the video. You can spiral around and make figure eights. So all these kind of movements, don't go into your labour going, I've got to do that and that and that. Just have them there. Birth support people, partners, remember these so that you can suggest them. So that when she says to you, I can't do this anymore, say, yes you can, you are doing it, let's try the horse's breath. Or yes you can, let's try that hip manipulation. You need to remember this, not her, okay? She's got enough work to do bringing that baby into the world. You need to remember all these techniques. Practice them now. So you practice them at 37 weeks pregnant, 38 weeks, and then when you get into, you're at home, you've got plenty of time. When you go into labour, you're just adding contractions. That's it, simple as that. Sounds simple, doesn't it?
Done.
It's a whole lot harder than that. But, all right, I've got my list. I'm gonna make sure we go through everything before I let you go. I think you're free. Yeah.
Right.
I'm going to show the birth space, but yeah, I think you're free.
Done.
So fit balls are great. Thank you very much
Would you like
for your
this back?
service. I would. You're just epic. He is epic normally. He's very, very epic. I'm going to show you, oh, before, hang on, sorry, can I just show them this?
Yep.
Do you want to take that away? So fit balls are great, but most hospitals will also have what's called a peanut ball, and it looks like a peanut. So it's a fit ball kind of material, but it goes like a wave, okay? And they have actually been shown to be epic for women with epidurals. So they've been shown to shorten the length of labour with women with epidural. So if you have an epidural, you really want to make sure you've got a peanut ball. And the best position, there's a few positions, you can Google them, but this is the best one where you're laying in the peanut balls between your legs. And what it's doing is it's opening up this pelvis, okay? It's getting you to open up. Because when you're on your back, you've got all that gravity and weight pushing down, and you actually close off the pelvic inlet. You make this space where your baby's got to descend and move through smaller and tighter. So the more open you can be, the more you can be on all fours, standing up, moving those hips around. You're going to help your baby to wiggle through, and you're going to open things up. All right, babe, bring it back. Another really cool thing to pack into your labour bag is a stress ball. So basically what we want to do is create some distraction techniques. Oh, I need you in my life all the time. But
I'm here every day, babe.
He is.
See everyone.
A stress ball is a really cool thing. So like horse's breath, like moaning or groaning, what we're trying to do is get you out of focusing on that pain in the uterus. Okay. Oh no, he has to come back. I'm going to bring him back. We've got to do physiological. You got to come back. We've got to set that all up again. So the stress ball, horse's breath, clicking your fingers, okay? I've got women that have clicked their fingers. I've had women that have had like a shoe and they've just been like doing this the whole time. IV poles, climbing your hands up, door frames hanging on. What they're doing is they're finding a distraction technique. And so rather than their labor being about, oh my goodness, the next contraction's coming, oh, it hurts, it hurts, it hurts. Their labor becomes about their distraction technique. So, okay, I've just had a rest and now I'm gonna go into my horse's breath. And I start that. Or right, the contraction's starting, I'm gonna click my fingers. And so the focus shifts from here and the pain into something else. And your labor becomes this rhythm of doing that. And that is awesome. Combine it with music. A music playlist is a must. It tricks the brain into feeling safe. We're going to talk about why you need to do that soon. But it's all that distraction techniques that really, really help. And you can practice them now, but you might not find them until you're in labor. But partners suggest things. You know, I've had women just have a hair tie and flick it. All right, let's take that back for a second. We'll leave the things here. Yeah, so now you're gonna get up. Yes, you are. I'm gonna have some water. If I've been going for like 6 hours, I probably have, knowing me. We're gonna do a wall squat. Yes, we are. All right, so you're gonna do one too. We're gonna do one together. I'm gonna get rid of this rug because it's a little bit dangerous. I want you to do a wall squat. So find a wall, you and your partner, both of you, because we are going to feel that physiological pain. We're going to do a little one contraction to train ourselves for our labor. Just one contraction. Come back, let's go. You're doing this too. All right, so we're going to go back to that because I don't have any wall space. You ready for this?
Mm-hmm.
Okay, let's show them how good we are. Don't you not be good. Okay.
Don't put too much pressure on me. Alright, you've got different size legs,
this
right?
could be like a fire. What are you doing?
What are we doing?
Okay, that's good.
Yeah?
That's probably too low.
Okay, I'm just going to push you over.
Just put your shoulders on my shoulders. Oh, so much better. Okay. Alright, so we're holding. Everyone holding. Now go into distraction technique. Because right now, if you're like, oh my goodness, my thighs are hurting, it hurts too much.
My thighs are hurting.
Your thighs are hurting. You have to come up, don't you? Go into your horse's breath, okay? You do it. So right now, my arms aren't hurting, okay? My tummy's not hurting, my core's not hurting, my shoulder's not hurting, my head's not hurting, my neck's not hurting. Well, your what?
Your husband's hurting.
Blow it out. Okay, and so what I'm doing is I'm distracting myself. So rather than being in the pain here, I know a really good PT if you need one.
Mm-hmm.
Rather than being about the pain here, I'm being about my distraction technique. You're my hair.
And I'm slipping.
Oh, I
I'm
couldn't do
slipping down,
it.
you need a wall.
Yeah, he was slipping. Anyway.
That was good anyway, that was amazing.
Yeah, if you didn't do that, you just had a good laugh instead, do your wall squat. All right, bring it back.
I'm out.
Bring it back. Oh, I don't know. Is anyone even still watching?
Yeah.
Oh, there's a love. Oh, that's someone who knows me. Does that still count? If it's someone who knows me that gave me love? I think it does.
It does.
All right. Okay. Oh, there's a lot to get through. Okay. So we did the stress ball. The next thing, this is one of my favourite things ever. It's really hard to do if you've never done it before. And I actually teach it in my programs, but it's diaphragmatic breathing. So what I want you to do now is take your hands, and I just leave this back. I can't sit like that. I have to sit in a supported squat. Take your hands and just breathe for me. So what I want you to do is inhale out and back again. So what we're doing here is we're shifting the breath into what's called the diaphragm. So the diaphragm sits right here under the ribs. And I like to, everyone explains it like a parachute looking muscle, but I think it looks like a Lego man's hairpiece. So it sits up here and it's what we should be breathing with. Most of us chest breathe. So what I want you to do is place your hand on your chest, everyone. Yeah, you too. Yeah, oh good, everyone's doing it. And just breathe through your chest for me. I can't really do it anymore because I've trained myself not to, but chest, make that chest rise and fall. How does it feel to do that? And you might need to close your eyes down. How does it feel? Typically, people say they're short of breath, a bit anxious, it doesn't feel good. So now what I want you to do is take your hands, and they're not here in your front, they're around here on your sides. And this can be hard to do if you're more into the late 30s weeks of your pregnancy. We want to take the hands more towards the back, because when we diaphragmatically breathe, we breathe 360, and that means that everything moves. So the diaphragmatic breath is great if you've got things like back pain as well, because it gets everything to loosen up and shift. But I want you now just to try and practice doing that breath for me. So as you can see, if you watch my hands, they're coming out to the side and back in again. And back in. Now, how does that make you feel? It should make you feel a bit calm and relaxed, and often when people do it, they feel like they're about to fall asleep, or they do. When we chest breathe, we stimulate our sympathetic nervous system. That's our nervous system that looks after us when we're scared, our flight or flight response. When we diaphragmatically breathe, we stimulate our parasympathetic system, which is our calm system. And that's what we want when we're in labour. So the diaphragmatic breath is a really beautiful thing to do and focus on in between contractions. Now, it's really important that we are calm because of our hormones. So does anyone know what hormone we release to make our uterus contract? I've said it a couple of times. You get bonus points if you popped it on. Oxytocin. So there's 4 different hormones that look after us in labour. So we release hormones, and so does our baby. And labour is really this beautiful hormone dance, this mix of different hormones. It's a perfect cocktail. And what often happens when women get robbed of the most empowering event of their life, when things happen in childbirth that takes the power away from women, and that experience is often to do with the hormone. So let's talk about oxytocin first. Oxytocin is released we call it the love drug. So we release it in orgasm. We release it when we have that overwhelming rush. So we have oxytocin receptors under our lip. So when we have that really smoochy, passionate kiss, that's oxytocin. If you've got children already and you see them and you get that rush of love, that's oxytocin. So this video I'm going to put on, it's about a heterosexual couple trying to make a baby, so trying to have sex in a hospital setting. And they do things to the man like we do to women in labour. Time them, tell them they're not doing it quick enough, put things like catheters in and stuff, and cannulas and all types of things like that. And obviously he doesn't ejaculate and they don't conceive a baby naturally. And so for labour to be efficient and effective, we have to do everything possible to get oxytocin flowing. High levels of oxytocin will mean a really effective, efficient labour. Low levels of oxytocin will slow down or stop your contractions. So we see it so often, women ring up and say, I'm having 4 contractions in 10 minutes, everything's going really well, and they come into the hospital and things slow down. Now, I don't see that a lot I haven't seen it a lot in my practice, because I typically look after women from the start of pregnancy to the end. I'm not doing it at the moment, but the majority of my career I've done that in what's called caseload midwifery. So for oxytocin to flow well, there needs to be trust. And when women trust their care providers, you don't get that shift into hospital. But what happens a lot of the time is that your senses get taking information, and then that affects the hormone levels. So we've got all these senses: vision, hearing, taste, touch, and smell. And when you walk into a hospital, it looks very different to a home environment. It's very clinical, it's very white, there's a lot of straight edges, there's a lot of bright lights and machines that go bing. And so your body is fed all this different information, and it can ramp up that adrenaline. So when oxytocin gets released, it sends messages to the uterus to tell it to contract and release. it's adrenaline is basically at the oxytocin receptors on the uterus going, you can't come in here. So when we have high levels of adrenaline when we're scared, labor doesn't work so well. And so it's the same with orgasm. You can't have an orgasm if you're scared. If you're at home with your partner having sex, what would the environment look like? Would you, I mean, some people will, love the lights on, but typically lights are low, there might be music, you might have dim lighting. You're not worried about if you've got little kids, you probably are. But, typically if you're at home having sex and I just went, knock, knock, hello, and I turned the light on and opened up and was like, oh yeah, it's just me, I'm just checking on you, just wanted to check your pulse. That's going to shift you and neither of you are probably going to orgasm. So doing things in your labor to increase oxytocin is going to make your labor more efficient. So what I want you to do now is jump up and have sex. No, I'm kidding. Turn the light off. So just turning the light on and off. So if I do it here, how does that make you feel? As opposed to the lights on. I've got bright shining lights and my oxytocin's on that. So we turn the lights back on. So that's why a lot of people think, oh, it's really hippie turning the lights off, but it's actually got a hell of a lot to do with your labor's efficiency and trying to get that oxytocin to flow. The same thing is, if I talk to you like this, I hope I haven't just woken my toddler up, or if I talk to you like this, it makes you feel a lot different. So I have a midwifery voice. I don't talk to women fast and loud in labour. I talk to them softly. I talk to them in a calm way. I talk to them in a way that will enable their oxytocin to be released. So doing things like wearing your own clothes, playing music, eating food, having people there that you know and that you trust. So your partner, your midwife or your doctor, you want a relationship with them. Things like that are going to make your labour much more efficient. And that's why we say stay at home. Be in your own smells. Be in things that your mind recognises or your senses recognise. So we've already talked about adrenaline. So we want to cut down adrenaline as much as we can, and using that diaphragmatic breath and things like the horse's breath and distraction techniques can make you feel calm. So anything that makes you feel calm and safe is going to get your uterus contracting more, which is why I talked about where you need to be in labour needs to be where you feel the safest. So some women will present to hospital earlier than other women, and that's because the safest place they feel is hospital. Other women will choose home birth because they don't feel safe in a hospital. And so it's really about choosing the right space for you that is going to allow those hormones that control your labour to work as efficiently as possible. Because when things slow down, so when that woman comes in and she was contracting really well and now she's not, and we see it a lot of the time in emergencies. So women are contracting beautifully and then all of a sudden baby's heartbeat might drop and people rush in and then we're like, oh, where did the contractions go? That's adrenaline. Okay, so if that's ever happened to you in your previous birth, that's what it is. That oxytocin hasn't been allowed to flow. The other awesome hormone we get in labour is endorphins. So endorphins are the calming, pain relief options, hormones. And they work really well with oxytocin. They kind of keep leveling up. And so you'll get to this point in your labour where things get really strong and you think, oh, it's getting too much now, and then the endorphins will kick in and all of a sudden it'll get easier and you'll get into that rhythm again and you'll go back into the swing of things, and then it'll get harder and then you'll get more endorphins, and it's this constant balance of endorphins and oxytocin. So when you don't have endorphins working well in your body, that's when women can feel that labour is excessively painful. It's too it hurts too much. And so again, the same things that help release oxytocin are the same things that help release endorphins. So calming, that focal point, being in control, having that nice rhythmic, this is what I'm doing, all the smells and senses, all your senses being flooded with good things that make you feel safe. All right. It also makes you feel really happy after birth. And I can remember after the birth of my baby and my husband were asleep, and I was like pinging, like I was like on next level high. And anyone that's had a baby before will know that you can't sleep, you're just on this absolute rush. Right, I'm conscious that I've been talking for a really long time and it's getting late, so I think I'm going to cut it short, and we'll talk about some other things in the next video. We'll talk about the cascade of intervention, we'll talk about epidurals, gas and morphine, and the waters breaking and all that in the next video, because I've just talked way too much. But I'm just going to recap with my balloon. So this was a technique that you may have seen already. Liz Chalmers used it in her video. So you've got the uterus here, the baby is a ping pong ball, and that's cervix. So what is happening is you're getting these contractions. And so we get contraction, release. So during that contraction, we're using things like our hip manipulation, our horse's breath, our distraction methods, gravity if we want, being active on the ball. And so the whole time, it's really, I've done this so many times and I always get scared that it's going to pop. But what you can see is happening is this uterus, this muscle, it's pushing down, and that cervix is starting to thin. So we're going to try and speed things up a little bit. So can you see how the cervix is now getting a lot thinner? So when we've got adrenaline in our system, it causes stress to baby as well as stress to mum. And so that's when intervention can kind of come in too. So again, limiting any, these are fast contractions obviously, limiting any adrenaline is great. So if you can see that, we're starting to now see the baby, and that cervix is getting even more and more thin. So if you've made it to this part of the video, thank you so much for watching. Thank you for being here. I hope it's everything you wanted and more. Hit me up with your questions. We'll get into some more stuff next week. I hope I've made sense. I get really passionate. I want women to have the most amazing experience ever, because you shouldn't be robbed of the best experience of your entire life. Giving birth was the most epic day of my entire life. It hurt, yeah, but I've never been more proud of myself. Okay, so if you made it to this part of the video, if you want to mentally and physically prepare yourself for labour, I have this epic program called Core and Floor Pregnancy. It's not just about the pelvic floor, it's education and exercise, proper exercise videos. They've got me in them, so you get to watch me over and over again. And if you've made it this far, you can use the code HOMEWORKOUT50 to get 50% off. So I'm going to try and get this Auslan interpreted, or I'm not going to try, I am, and I have to pay for that. So 4 of you have to buy the program so that I can afford it, please, pretty please. So 50% off will get you the program for $49.50. You get 2 years access. There's also postnatal ones. Oh, see how well I'm like marketing while I'm labouring. There's a postnatal program as well called Core and Floor Restore, so you can get the both of them for like $79 or something ridiculously cheap. So jump on my website. That offer will be valid until midnight tonight. So if you don't do it now, it'll expire. So you can see now my baby is starting to come through. That cervix, can you see how it's thinned out completely now? So it's completely thinned out. It's gone from that long thing. See, labour can be long. It's gone from being long and thick to now being really thin. And are we getting more and more of the baby's head? Yes. So you can see it's coming out. Oh, I'm just too scared. I hate balloons popping. I need to just keep going. Okay. You get the idea, yeah? So we're basically going to get out. I'm going to leave it there, and then we're going to do the next bit of our labour next week. So it's going to be a really long labour. I hope you've enjoyed that. Hit me up with any questions. Sorry I took so long. I like to talk. We'll get onto the other stuff next week. Thanks so much for tuning in.